Hi all, this is Hadley Morrow, the Director of Community Engagement here at Better Health Together. Thanks for tuning in. I am here today to walk you through some of the finer details of our letter of interest request for Medicaid Demonstration Projects. So just a little reminder of the timeline we're on. It wasn't until January 9th this year that we found out we had reached agreement and approval for the demonstration project from CMS. Since then, the Healthcare Authority has been working really hard to finalize some of the details and get out information to all of the ACHs about what will be required of us for the planning process and submitting our final project templates in October. So it's a really quick timeline. We're going to have to know by September, essentially, which of the projects we will take on as a region throughout the next 5 years. So just as a reminder, what those projects are, they're tiered in 3 different domains. If you look here at the bottom, domain 1 is really focused on the infrastructure piece. There are projects that are really statewide initiatives that will happen alongside all of the domain 2 and domain 3 projects. Domain 2 is focused on care delivery redesign, and we'll remind you that bidirectional integration of care is a required project within that domain. And domain 3 is really where we start to look at specific health priorities that came up as important to the communities. And in this one, addressing the opioid crisis is another required project. BHT will have to choose one additional optional project from domain 3 and domain 2, along with all of the required projects for the demonstration. This letter of interest process is really specific to those optional projects, looking to gauge where there's momentum around those different models and who in the community is interested in spearheading one of those projects. So looking at the process that BHT has gone through so far, in March we sent out a survey to our leadership council, board members, health champions. Hopefully it's been forwarded more and more throughout the community, just to get feedback on which of the projects felt like the best fit for our region. From there, on March 31st, right after our leadership council meeting, we sent out the first request for letters of interest for projects to be considered in the BHT portfolio. Those letters of interest are due on May 15th, and we'll be talking about that quite a bit more today. After the LOI, the intent is that the board will review those letters and then invite selected projects to continue on to a community showcase event, which we're thinking of like a TED Talk or sort of Shark Tank style quick pitch, where organizations will have about 3 to 8 minutes to sort of pitch their project to the audience, which will be made up of community members, board members, and the leadership council. And BHT will use that to get feedback from our community on these projects. From there, the board will continue to evaluate and then invite folks to join in on work groups that will meet throughout the summer to develop the implementation plan, outcomes, and design the real project. Our goal is that by September 20th, the board has made their decision so that we can put everything into the project templates and submit them to Healthcare Authority by October. This is another graphic of our project selection timeline, which you have linked in the LOI document in case you need a quick reminder on what our dates are looking like. Okay, also, before we get too far into the LOI, I want to take a minute to just ground us in the overall goals of these projects. Remember, there are 4 overarching goals to Medicaid transformation under Healthier Washington, and they are reducing avoidable use of intensive services, so that's making sure people get the right care at the right time so they don't end up in costly institutions or using the ER inappropriately. Another goal is to improve population health with a major focus on prevention and addressing some chronic diseases facing our region. Next, accelerate the transition to value-based payment. So we're moving towards a system that pays for outcomes instead of the current system we have that pays for each service. And then finally, the last goal, which is really the overarching goal of Medicaid transformation, is to ensure that our state's Medicaid cost growth stays below the national trends. What we're trying to demonstrate here is that when we do Medicaid our way with these innovative projects, we can save money. And of course, our own region has its own priorities, which were developed in our first year of existence through just hours of community meetings and conversations. We went out and asked folks what their most pressing health priorities were, and synthesized those responses down to these 5 goals, which are dramatically improving whole person care through the integration of health systems, expanding oral health access, developing strong community linkages that connect social services to clinical and health services, dramatically decreasing obesity rates with a focus on prevention, and finally scaling community-based care coordination to help folks navigate to the care and services that they need. All right, so what are our expectations for this LOI? Really, it's meant to be simple, quick and painless, easy way for us to learn who is interested in collaborating on Medicaid demonstration projects. So it's really our belief that our region is going to have the most success if we can focus on projects where there's already an energy in the local community, there's already some momentum and some work being done that we can scale and grow rather than trying to reinvent the wheel and start a new project from scratch. So really, this is an all call. We're looking to see who has something to offer for these projects. The BHT board is appointing an evaluation team who will review these letters and select projects that are consistent with the goals and expectations to continue on to a full application project. So authors of similar or maybe complementary LOIs may be invited by the board to collaborate on a full project application. So know that this LOI process is going to be a place where we're looking for ways to link projects with greater collaboration and for more impact. Most importantly, please don't be discouraged by this LOI. If it feels complicated, I mean, we know this stuff is really complicated, so if you have questions, you can reach out to us. Also, throughout the full application process, we're going to have access to very technical TA support from Manat, who will be able to help us through designing some of the more complex stuff like the funds flow and looking at value-based payments. So know that there will be help with some of these complexities. All right, the other huge expectation that is so important to this LOI is that you use the Transformation Toolkit. This toolkit is really a framework for all of the projects in demonstration. You can find it here at this link. It lays out a rationale and some background on all of the different optional projects, as well as lists of evidence-based models that have been approved for demonstration. So these projects can only use the evidence-based models that are listed in the Transformation Toolkit. There are some instances where you can use a like model or a similar adaptation of the model. However, it's going to have to be strongly justified, and you're going to want to show evidence for why you would choose an adaptation over the actual model. So before you sit down and start writing an LOI, make sure you become very familiar with the toolkit and the expectations laid out in it. Additionally to the models, there are planning and implementation suggestions for each of the different projects. And in the back, there's also an appendix with all of the outcomes that will be tied to incentive payments throughout this project. So those are the outcomes that we're going to have to meet in order to receive demonstration funds. So you're going to need to make sure that your project is aligned with those outcomes. Okay, so you'll see here that we released this original letter of interest on March 30th, but we have since updated it just on Monday, April 10th. And as I walk through this document, I will call out the changes that have been made since the original release. So on the front page, we just have some background on BHT and this opportunity. Here we have a little more context, some information about the process, and here I'd like to call your attention to these links because we've created essentially a short one sheet of information on each of these projects that you can look at. I want to make it very clear that these one sheets do not replace the toolkit, and no matter what, you still need to sit down and get some quality time with each of these projects in the toolkit before you'd be ready to submit an LOI. LOIs are due electronically on May 15th by end of day at 5 p.m. And please email them to transformationprojects@betterhealthtogether.org. Here we have some more information on our timeline, as well as an overview of the criteria we'll be using to evaluate these projects. I'm going to go into that criteria a little more later. Then some resources that can help you in this process. So if you are looking for some time with BHT staff to get feedback or ask questions about your projects, we have created some drop-in times that you can sign up for. And as always, you can email myself or our executive director, Allison Carl White, with any questions that you might have. Here we have a link to that survey that I mentioned we launched on March 1st, which is intending just to get a broad idea of where there's interest around projects. If you haven't taken that survey, even if you're about to submit a letter of interest, please do take the survey, because it's really helpful data for us, and feel free to pass it along to any of your contacts. All right, so let's get into the LOI. The big change that we've made from the very first release was we've created 2 different sections now. There's one form specific to folks who are interested in managing a project, taking more of a leadership role in designing and implementing the project. We'd ask you to then complete a project proposal here. Additionally, if you're feeling like your organization does not have capacity or interest to play a management or a leadership role, but you see yourself as a needed piece for this project's success, or you have something to offer in collaboration, maybe it's services or resources, content expertise, we would ask you to submit a partnership proposal, which lets us know more about your organization and how you see yourself collaborating on this project. So here in this cover sheet, we'd ask you to fill out who will be the main point of contact for the submission, as well as sort of check what you'll be submitting for. So you are more than welcome to submit partner or project proposals for multiple initiatives. Please complete only one form per project, however. So feel free to, copy and paste or print multiple versions of this in order to have one per project. All right, so let's take a look at these project proposals. Again, this is for folks who have an interest in a leadership role or a more coordinating role for the Medicaid demonstration projects. We would strongly encourage you to collaborate with other entities on these project proposals. As I said earlier, all of the projects are going to require a very high level of collaboration across sectors. So the more you can do to show us now that you're thinking about this collaboration, or you're reaching out to other entities that you'll need at the table for this project, the more positioned for success your proposal will appear. For this form, which again, it's just 2 pages, we're trying to make it as simple as possible. We'd ask that you give us the title of your project, list the organizations who will be involved, give us a little information about who you serve, which counties and tribes. Is this project new, or is it enhancing an existing project? So are you starting from scratch, or is this a model or a project that is already in place by your organization that you are proposing to scale or enhance to align with the demonstration projects? Please go ahead and check which of the initiatives your project is going to relate to. It's possible that a project may touch more than one initiative, so feel free to select more than one, but we would ask you to circle the primary area that this project would fall under. Then let us know which sectors will be engaged by this project. Feel free to list if there's groups in here that we forgot. And then go ahead and give us just a brief description of the project. What do you propose to do? How is it going to look? Who's going to do it? Sort of what are the roles and responsibilities of your project? Then we want to know what your goal is. What are you hoping to achieve? And then a brief description of your project scope. So where are you going to launch this project? Is there a certain target population you're aiming to impact? Will you be working within a specific health system or a specific provider? Let us know really what your target is. And additionally, if you have plans to scale this target population into broader community impact. So say you're starting with a small target population as a pilot, let us know how you plan to scale that so that we can really meet regional impact within 5 years. This last section is looking for how your project aligns with the expectations of Medicaid demonstration. So here we're asking you to look through the toolkit and list which of the models it is you're proposing to use. And if you are proposing an adaptation or variation of the model, this would be a space where you'd want to justify why you'd prefer the adaptation and give some evidence to validate that it's still it's still a workable model. We'd then like you to check which, if any, of BHT's priority areas this project would fall under. And then go back to the toolkit one more time and take a look of the measures that are listed in the appendix and let us know which of these measures you will be impacting through your project. It would be helpful for us if you could sort of rank them in the order of most impact. Again, friendly reminder, this is not a grant, so payments are going to be tied specifically to achieving these listed outcomes. That's why it's so important that we know that your project is tied to them and has the ability to meet those outcomes. All right, let's take a look at the partnership proposal. So again, this is for organizations that are interested in partnering or collaborating on a project, but not taking a leadership role. So first of all, we just need some background on you and your organization. Help us get to know you. So which counties do you serve? Do you serve any of the tribes? And please describe your organization. Just give us a brief understanding of your mission and sort of what services or resources you offer. Who is your target population? Who do you mostly aim to serve? And then please share just a brief description of where you get the bulk of your funding. Again, because this is not a grant, we're looking for ways that we can creatively tie in funding to make sure that these projects are sustainable through the 5-year demonstration and beyond. And a description of your funding sources helps us think about that. And then we get into more of the details of how you propose to partnership. So we'd ask that you complete one of these partnership proposal forms for each of the projects you see a role in. So please go ahead and either print multiple copies or copy and paste this section for each project you're interested in. First of all, give us a short description of how you see your organization supporting this project, or how would you play a role? Would you provide service? Would you refer clients? What is it you see as being your best fit? And then we have the same questions as with the above project proposal for how you align with Medicaid demonstration. So let us know again which of the evidence-based models you would be using or perhaps are already using in your workforce. Then please share which of the toolkit measures, if any, you could propose to impact or maybe currently are working to impact in your work. And then finally, same as above, we need to know if you have the capacity and willingness to share data with us for evaluation. So that's that. We aim to make it as short and straightforward as possible. With the really intense speed of demonstration, we feel strongly that we're best positioned for success if we can select projects that have captured existing community momentum, which is why we're really interested now in this broad base of who's interested, what can they offer, where are there opportunities for collaboration. All right, so the last thing I want to do today is walk us through some of the criteria that the BHT board evaluation team is going to use to evaluate projects at the community pitch event. This criteria was adapted from the first set of criteria that we used to evaluate the original Medicaid project proposals that were sent to the Healthcare Authority as part of our application for Medicaid demonstration. We've taken that criteria and we're currently working on adapting it into a scorecard that we'll use at the community pitch event for audience members to evaluate the different projects that are presented. I do want to just remind you all that we expect this LOI to be brief and simple, and there's 12 criteria here total, so we don't expect that you'll be able to speak to each of these criteria in your LOI. However, if you're able to show thoughtful consideration of these criteria throughout your proposal, you'll definitely be better positioned for success. All right, so the first we're looking at is outcomes. What we're really looking for here is we want to see that you have, first of all, a willingness to share and collect your data with us so that we can evaluate the program, and additionally, that the outcomes that you're working on are in alignment with the toolkit measures. So this is where you're going to need to open up that toolkit and make sure that you are referencing outcomes that are listed in the toolkit projects and linked to incentive payments throughout the demonstration. Sustainability. So I think I've said this once before, but as a reminder, this is not a grant. We are not applying for upfront funds to run a program. So we need to see that you've considered where we can leverage other funding sources to make sure that this project is sustainable through the 5-year demonstration and beyond. Next, we want you to sort of show us what is the return on investment from your project. This doesn't necessarily have to be a dollar calculation. We understand it's sometimes really difficult to calculate the impact of money not spent. However, we do want to see at least some sort of narrative that walks us through what the expected improvements or changes to the health system will look like as a result of your project. So this may look something like, because our project proposes to get this many women well child visits, we expect this many children will have better outcomes or reduced costs in this way. So show us how you see long-term systems benefits happening as a result of your project. The next thing we're going to be looking at is impact. So we want to know how likely it is that your target population will track to a high enough level of impact within the 5-year demonstration to make regional impact. So it may be that you're starting with a really small target population. We're going to want to know how that's going to be scaled to make regional impact. So here we're going to use what we're calling a health equity calculator. That's going to evaluate, that'll be a way for us to evaluate your population. So we're going to be looking at size, how many people do you expect to serve, what's the level of disparity within that population. Also, is there high scalability? Is this something that we can easily grow to new communities or new counties and across the region? And then also, where is your intervention really aimed? Is it upstream or downstream? Is this standing to be more of a preventative project that's going to, keep people from becoming ill or from ending up in expensive institutions? Or is this more of a downstream intervention that's treating an already existing issue? So here we're going to want to see that you show us a great description of who your target population is and what the impact's going to be on them. All right, next is the project statement. This is really where you're describing to us what your proposal is, what's the problem you're looking to solve, and how will your intervention solve that problem. So first of all, we want to see that you have a strong understanding of the problem and that it's tied to both the regional priorities and the goals of Medicaid demonstration. So we do want to make sure that all of the projects are true to the community's needs. Additionally, we want to see how the intervention that you're proposing will specifically fill the gaps that you identify in that problem. So this is where you're going to really want to show us how your project is going to solve this problem. Evaluation. So we're going to have really heavy reporting requirements to the healthcare authority because these projects will be so outcomes based. We're going to have really strong systems in place to evaluate the programs, collect and measure data. So here we need to see that we need you to show us what systems you have in place to capture and share data, and also we want to see that you have a willingness to share and collaborate with that data. And finally, do you have any plans or any milestones where you can evaluate your project to potentially course correct if it looks like you're not going to meet the outcomes? All right, these ones are a little more straightforward. So aligned with Medicaid demonstration project models, like I said, that's going back to the toolkit again. So you need to make sure that the the interventions that you propose to use are called out in the Medicaid Transformation Toolkit. And if they're not, if you're proposing to use a variation or a deviation from the model, please justify to us why you've chosen this adaptation and what evidence backs that this will still be a working model. Readiness. So remember that timeline back in the first slide? We're moving really, really fast. We need to know that your project is ready to launch on January 1st, 2018. Now, that doesn't necessarily mean it's a full-scale launch. It may be that you plan to start with a small population or a small target and then expand. Please show us what your plan to scale is in order to meet the 5-year goals. What we want to know is, what will you have in place on January 1st, 2018? And then collaboration. We've said collaboration will be, a heavy part of all of these projects, and we really want to see multi-sector collaboration demonstrated in each project. So show us in your proposal both what's your track record for collaboration, how involved have you been in partnerships within the community, and how can you demonstrate to us that you're committed to continuing to collaborate and that the partnerships that you are working on are strong. And also show us that you've reached out to these partners and you've collaborated on your project proposal. We want to see that other partners have been involved in the planning of this project as well. Workforce. So this is where you're going to show us sort of what your staffing model is, what are the different roles and responsibilities within your project. We need to know that you have adequate staffing to launch on January 1st, or that you've clearly identified what your needs or gaps are for that start date. Additionally, there's an opportunity for us to align with the statewide workforce development goals and regional workforce development goals, and we would like you to show us if you see a way that your project aligns with those development plans and is helping to address some of the workforce issues in our region. All right, and this final criteria listed is a track record of leadership. So we will be asking partners to take a strong coordinating and leadership role in each of these projects. So we need to know that your organization and the partners involved are really committed to carrying this project through the 5-year demonstration and potentially beyond. So in that, we're looking for what's your history of engagement within the community, how do you show up in the community and with your partners, and what has your level of engagement been with the ACH? Have you shown a strong commitment and understanding of the complexities of this work? Also, we need to know that you're the kind of leader that's committed to getting the right partners to the table and keeping them engaged, because this is going to be a long process, and can implement effective program management and sort of meet the outcomes of this project. All right, so that wraps up our webinar. I am really glad you all joined. I hope this has been helpful for you. I want to close out with just a few last resources that we are making available to anyone needing assistance or feedback on their LOIs. I will be hosting office hours 1 day a week up until the week of May 15th. That's a chunk of time where you can schedule a half-an-hour slot with me to talk through your LOI. These are available in person or over the phone via conference call. You can use that link that's right there on your screen to just self-sign up for a 30-minute slot, and or you're also welcome to email me, hadley@betterhealthtogether.org, if that doesn't meet your time, if a good time for you isn't available, or you just want to do a quick check-in call. You're so welcome to email me or Allison Carl White, our executive director, with any questions or any support you need on this LOI. Again, it's really our intent to make this simple and easy so that we can start seeing what's out there in our community and get to work. I am just really excited to finally be at this stage, and we can't wait to see what kind of project ideas you have. So send them on in, folks. Let's get to work.